This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Okay. All right. You guys see the full screen PowerPoint?
Yeah,
okay,
you're good.
Cool. All right. So we're from Stony Brook. Stony Brook is on Long Island, about an hour and a half drive from the city east. We are affiliated with Stony Brook, St. Charles, which is part of Catholic Health, and the VA, which is in Northport on Long Island. So Dr. Gray is our program director. Dr. Silverman is the associate program director. Dr. Lombardo is our site director at the VA, and Dennis is our wonderful program coordinator, who I'm pretty sure has been there since the inception.
Yeah.
That is correct.
Yes.
Sorry, I was having a hard time unmuting.
So like I said, we rotate at St. Charles Hospital, the Northport VA, and at Stony Brook, Maine. The first residency class graduated in 2000, started in 1997. 24 classes have graduated since. We're fully accredited, 3 residents per year, so that leaves 9 residents total. We are an advanced program. This is a picture of St. Charles. It was founded over 100 years ago by the Daughters of Wisdom. They came from Europe. It began as a hospital for children with disabilities, which is very interesting as a base for physiatry as a field. St. Charles was definitely one of the first to really address people with disabilities and give them a place to get treatment and help. Now has a 76-bed rehab service in addition to having a full-service hospital. The PM&R department is the largest in the hospital. We also rotate at the Northport VA. This is where we do a lot of our EMGs, joint injections, a lot of Botox injections for spasticity and migraines, a lot of trigger point injections, acupuncture, and it's a very unique patient population you're treating here, as they were all veterans. And it's really the only VA on Long Island, so you're serving a very large geographic area. I know there's one in Brooklyn, but besides that, east, it's only this one on Long Island. And that's, for those of you who don't know, from end to end, it takes probably around 3 hours to go from one end of Long Island to the other. And this is a picture of Stony Brook, Maine. This is where you would do your EMG neuromuscular rotations, your interventional spine rotations, your pain rotations, and things like that at the main hospital and their outpatient clinics throughout Long Island. As a resident, you get a few textbooks. You get the Preston Shapiro EMG book, the Jacobson ultrasound book, and Cucurilla's board review book. The program will pay for your membership for AAPMR and AAP. As a PGY4, you will have access to the Kessler review course for boards. I think it's a Sunday through a Thursday. You're not charged vacation time for that. You get those days off, and the program pays for it. You also get a $2,000 stipend every academic year for conferences you want to attend. And you also get 5 conference days each year in addition to your 4 weeks of PTO. You also get a subscription to PM&R Recap. They have a lot of great videos and very large question bank and a good book. These are some numbers about salary and benefits. The salary just went up and I think is scheduled to keep going up over the next 3 years. There's more information of that on the website. Like I said, you get 4 weeks vacation, 5 days for conferences. Health insurance is through Anthem. I think that used to be Blue Cross Blue Shield. For the basic plan, there's no cost for that. There's no charge, and it's pretty good insurance. Pretty much covers a lot of things, and you can pay. They're pretty small, I think, deductibles from your paycheck if you want to enhance the benefits. And as a chief resident, you get a $1,000 stipend in addition to your base salary. This is some information about the call schedule. It's as a PGY2, you take about 6 calls per month, 5 calls per month. And as a 4, you take 4 calls per month with no weekends. That means no Friday, Saturday, or Sunday. When you are on call, you're there from 5 to 7, covering the rehab floors. And then you are also doing any admissions that will come after 4 o'clock. PAs cover the floor overnight, and you won't get calls overnight because the PAs are covering and will answer any pages. Some more info about the rotations. At St. Charles itself, you're going to have 12 months total about of inpatient rehab. There's patients in neuro rehab, ortho, trauma, amputee rehab. You have 2 months of pediatric rehab, which is mix of inpatient and outpatient. Outpatient, you're going to see Botox exposure. You're going to have experience rotating with the pediatric orthopedic surgeons, seeing the procedures they're doing, whether it's limb lengthening, tendon adjustments, fractures. You're also going to have 2 months of outpatient at St. Charles. There's a big clinic at St. Charles itself, which is more MSK, neuro rehab, spasticity, and neuromuscular rehab. At the VA, you're there 4 months each year in 2 2-month blocks. So all the rotations are done in 2-month blocks. And each year you're going to have 2 blocks at the VA where you'll do a lot of EMGs, joint injections. There's a big migraine clinic. As a PGY2, you're going to be injecting, I think in my PGY2, I probably injected 50 or 60 people for migraines with Botox. So you get a lot of early exposure, especially in your second year.
You definitely do more.
Yeah. There's a wheelchair clinic, a prosthetics clinic, all at the VA. It's really interesting. It's all outpatient, and it's a population that really appreciates your help. For a lot of people, that's their only option to go to as far as healthcare. So they're very appreciative of you being there. And then at Stony Brook, Maine, you have 2 months of interventional spine as a PGY3, 2 months of EMG as a PGY4, and there's also 2 months of selective and elective time in your PGY3 and PGY4 that you can do at Stony Brook, at other locations. And if there's a field you want to consider pursuing, you can also do an away rotation. We do didactics on Mondays and Thursday afternoons from 1:30 to 4, and that's protected time. You won't have to answer pages. You won't have to attend to things on the floor. The attendings are there for that, so you can focus on lectures. A lot of them are hands-on, whether it's with PT, OT, speech. Guest lecturers come in. We'll do journal clubs, go through question banks, a lot of different variety. These are the 10 modules that we will cover in didactics. Like I said, we have ultrasound workshops once a month at least at the VA where we'll focus on a specific body part. One of the residents will give a lecture on that body part, and then we will go over how to ultrasound that area. We'll also review journals, board questions, roundtables. We also have a monthly research and QI meeting where we'll go over any case reports, any research we're doing, any ideas for QI projects as well. We have a research coordinator at the hospital who's there to help as well. There's also a librarian at Stony Brook with the medical school that can help. There's a lot of different options from different resources. These are some of the current research projects at St. Charles and at Stony Brook. activities of former residents, it's widespread. A lot will go into private practice. I'd say most go to fellowship. A lot have gone the pain route, interventional spine. These are some of the places they've gone to. Had residents go to Cleveland Clinic for neuromuscular med, MD Anderson for cancer rehab. Last year, one of our residents went to Andrews Sports Med in Alabama for sports medicine. The year before that, one of our residents went to Burke for sports med. And a lot of the alumni are either faculty currently or still practicing in the Long Island area. Our program director was also an alumni of the program. And these are some recent pictures. We do get out and have fun together. On the right, that was a few weeks ago. There was a hospital physician outing at Topgolf. It was great. They had food. They rented the bays. And on the left, we were wearing our sponsored jackets. Unfortunately, the two on the ends were a little bit cut off, but we're going to work on that picture this year and make sure that no one's cut off. And if you guys have any questions, feel free to ask.
I think there's some questions in the chat as well.
So what kind of mentorship in career guidance is provided to the residents? So your first year when you start off, they, depending on your what you're interested in, we try to match you with someone who is in that field. So I was matched with a sports doctor. If you're into pain, we'll find you. We have like plenty of pain people. So we match you with whichever field you're interested in. Outside of ultrasound workshop, how often do you guys practice ultrasound with each other? So every month we get a lecture on ultrasound. So like 3 hours. But then the big time where you get a lot of practice. So it's when you're at the VA, you have the ultrasound is there with you like all day, every day. So you get there. We often get there early, and we'll practice on each other. Like Dr. Lombardo, the site director, is very like always willing to help you out and like work through it with you. So. And we also have one at at St. Charles, but I guess we don't really use it. But yeah, we have it. It's mostly at the VA. That's when you have it. Like you can use it. We pretty much use it every day.
Yeah, I mean you can use it whenever you want. It's there's two at the VA that are readily available. There's one at St. Charles readily available. You can really go start using it whenever you want. There's no one else using them. They're really just for us. So that's nice. No one else is going to say, oh, I need this right now. So we're really the only ones using it. Thinking someone said, what is the patient demographic like in Long Island? So it's a very wide variety. So we're out east. Yeah. So, I mean, we're getting a big, geographic area. I mean, it's anywhere. People come from the city, so people will be from here, go to the city.
People come from Texas and Florida.
Someone's coming from the Outer Banks. But
he's right. People come from the city. We have like on Long Island, we have a good reputation, a really quite good reputation. So people will come. And to answer that question, it really depends on what specialty or what you're rotating in. If you're in the inpatient, you're mostly obviously going to see the elderly population. If you're in pediatric, you're going to see our pediatric population, like the ones we see, are generally like somewhere between, say, 5 to 12 or something like that. We don't see all that many, like, I guess, older teenagers. But then you see that patient population when you do the ortho peds. That's like you see a bunch of you'll see from a few months old. Like I've seen a few week old babies to I think he sees all the way to a 25-year-old. So and then the VA, same. You'll see. I've seen 19-year olds with back pain, up to 80-year-olds also with back pain. So, it's really quite diverse. And also like in terms of like socioeconomics, like diversity, the inpatient is also pretty diverse, and with the VA also so you really get to see quite a good variety.
I can add to Etienne. I think the population of Long Island has grown to be more diverse, let's say over the past 10, 20 plus years. I grew up on Long Island, so I see that kind of shift, and I think that is shown in our patient population as well. I did want to add one other thing, if I could, just quickly. These guys have to give themselves more credit because they all really actively participate in quality improvement, which is a very important part of medicine in general. And all of our residents for the past many years have graduated with a QI project approved by the American Board of PM&R. And if you do complete one of those projects and have it approved by the American Board prior to graduation, it counts for your first one. This is a little early to think about right now, but thinking ahead, it's kind of something that we strive for, so everybody can have a project approved. So it'll kind of save you time in your first 5 years of attending hood. So I just wanted to add that.
Yeah, and I guess for those of you who don't know what Long Island is like, food's amazing. There's a lot of outdoor things. There's beaches everywhere. There's hikes. There's places to kayak.
So I see.
Right.
What is the entrustment process like for attendings to allow you to conduct more procedures? So again, that depends. So you have as Aaron will see, as PGY3, as you rotate, you start by maybe watching a few procedures, but pretty quickly, if attendings will let you like do injections or anything like that. But the one that's is at the VA, it's you're doing a lot of like, so the injections with Dr. Lombardo, who's really good at like letting you kind of discover, like figure your own ways and doing your own thing. I know with at some point we wanted to do a hip injection and only use the curvy linear probe, and we were like kind of wanted to use a linear, and he was just like, you know what, do it. Honestly, like if that's how you feel about doing it, just do it. I wouldn't, but by all means, make it your own. So there's that, and also for EMGs, they will at first they'll like hold your hand a bit, but as they see that you know what you're doing, they will come and check it. Unless you have any issues, you can call them. They're right next door, so you can go check them out. You can go ask them. Otherwise, for the first portion, like the nerve conduction, they'll come and check out the results.
2 minutes.
You get a lot of independent. You have a lot of independence.
Yeah, I just want to answer that last question since there's 2 minutes about exposure to pelvic rehab, interest outside the core. So I'm interested in cancer rehab, and we don't have a cancer rehab service right now. So I'm scheduling a away rotation at MD Anderson in Texas. So there is a lot of opportunity to explore something that if you can't find it there, everyone is very open to letting you explore and learn more about what you're interested in. I think, did we hit them all? You guys could also email if you have more questions. I think that might have hit them all.
I think and there was strength or aspects of the program you would consider unique to Stony Brook.
the Seaport Deli. Google Google the Seaport Deli, and if you can ever get out there to have a sandwich, it's arguably one of the best sandwiches in the world.
I'll say in terms of unique strengths, I think I have a hard time imagining any other program having a better work-life balance. I think there's really like, I feel like there's no unnecessary tasks that you're asked to do. Everything is very targeted and very, if you're asked to do something, it's very useful. And all the superfluous like stuff, you don't have to do it. And so you get to focus on doing other stuff, stuff that you're actually interested in.